Distance Learning Pack 2. Introduction to Arthrology. The prefix arthro refers to joints. Arthroscopy refers to an investigation or a scope into a joint. Arthrodesis is a fusion of a joint. Arthrology is the study of joints. Joints are formed where any two or more bones come together. These can be true joints, true articulations, or pseudo joints, false articulations. The role of joints is to allow movement, and this would be to varying degrees. Some joints fuse in later life and no longer permit movement. It's the design and structure of the joint that determines how much movement is available. Joints are classified according to the tissue filling the joint space. There is a primary classification of a fibrous joint, a cartilaginous joint, or a synovial joint. A fibrous joint is a joint whereby there is fibrous tissue or a ligament lying between the two bones. A cartilaginous joint is where there is a pad of cartilage lying between the two bones, and a synovial joint is where we have synovial fluid lying between the two joints. And each of these three primary classifications will have a subclassification. The amount of mobility available is greatest in synovial joints. These are freely movable joints. Cartilaginous joints are partially movable, and fibrous joints are the least mobile. The secondary classification of fibrous joints is as follows. There is a suture. Here we can see two pictures of the bones of the skull. The joint surfaces are usually serrated and very close fitting. The cranial sutures are united by a layer of fibrous tissue, a ligament that goes all the way along the actual suture itself. So along here and along here. Now these joints usually fuse quite late on in life, usually by the second or third decade. This is now a bony fusion. This becomes a bony fusion and there is no movement. The primary role of these joints is to allow movement of the cranial bones during birth. The second type of fibrous joint we have is a gomphosis joint. This is a peg and socket arrangement, and the best example of a gomphosis joint is a tooth being held in the mandible. The tooth itself is held in place by a very strong ligament. There is very little movement available here under normal circumstances. The final joint is a syndesmosis joint, and the best example of a syndesmosis joint is the joint between the lower end of the tibia and fibula. These are plain joint surfaces, sometimes slightly roughened, united by an interosseous ligament, for example the inferior tibiofibular joint. Clinically, we get to see and treat plenty of syndesmosis injuries. The second type of joint that we're going to discuss are cartilaginous joints. And in this situation, a pad of cartilage is found between the two separate bone segments. Primary cartilaginous joints, also called synchondrosis joints, are found at the ends of long bones between the diaphysis and the epiphysis. Their role is predominantly for growth, for longitudinal growth of bones, and in this situation there is a hyaline cartilage template lying between the two bone ends. Under normal circumstances there should be no appreciable movement. Occasionally we will come across conditions where there is movement at the epiphyseal plate. These are usually pathological. For example, Osgood-Schlatter's disease, Sever's disease and Sherman's disease are all disturbances of the epiphyseal plates. Secondary cartilaginous joints are also known as symphysis joints. These lie in the midline of the body. For example, the intervertebral discs between the adjacent vertebral bodies and in the symphysis pubis. The bone ends are usually covered in a tough layer of hyaline cartilage, and there is a fibrocartilaginous pad in between these two areas. They're usually reinforced by ligaments, and they do permit a small amount of motion, but the primary function of the cartilage pad is to create stability.